Ravi, thanks for joining me today as we talk to leaders of Woodruff Health Sciences as well as Emory Healthcare. You've been here a few years, I should say, and have an important role for Woodruff Health Sciences and Emory Healthcare at Grady Hospital. First, tell us about yourself.
Yeah, thanks for the opportunity to be here and chat in this conversation. I'm not from Atlanta. I grew up in southeastern Michigan, did sort of a tour of the Great Lakes, and ultimately, when I was finishing my residency, wanted to be a trauma surgeon at the time and chose to come to Grady to be a trauma fellow. And so, like many of our faculty, that opportunity to train in that environment was really important to me at the time, and now Grady was the best place in the world to train for trauma surgery. I since had a change in heart and ended up doing a vascular fellowship afterwards, so my advice for everyone out there is don't do that. Don't do more than one fellowship. That's not smart. But started the vascular surgery program at Grady in 2011 as a faculty member, really proud of what we did, and have grown it into its own entity. And then, as you alluded to, for the last 2 years or so, I've been the Executive Associate Dean for Emory at Grady, within the School of Medicine, working under Dr. Dean Wan's leadership to sort of oversee our clinical, research, educational, advocacy activities on the Grady campus.
Yeah, such a big role over the past few years, and over 15 years in sort of vascular surgery as a leader in that space. Let's talk about our learners. We have learners at our School of Medicine that go to various sections of our organization. We have 11 hospitals. We have all these facilities. They treasure those experiences. One experience, of course, they treasure is their time at Grady. Tell us about that.
Yeah, I think Grady is one of the wonderful places in this country to receive medical education. I think it really starts at the medical student level and the residency level. It's to some fellowship programs as well. Ultimately, at any given time, there are more learners from Emory at Grady than any other single site, and I don't think people always realize that. Obviously, the Emory core hospitals as a whole are bigger, but at any given time, that's where the majority are compared to any other site. And it's a lot of the reason that people come here. At the end of the day, if you take that experience away, I think you lose something about what it means to learn healthcare in this country and what real healthcare delivery for a variety of different environments might look like. But at its core, we're so obviously reliant on the excellence of teaching among our faculty who are there. I think that's the real special sauce.
I know the faculty, I've spoken to faculty there, they absolutely love the fact that they teach and work at the same place at the highest level.
Yeah, I think their commitment to the core aspects of the mission represent what it means when you combine Emory and Grady together in that Emory at Grady community. That's the highlight to me.
Yeah, Grady not only is an outstanding place to train, but it also is known for a few areas that really put a spotlight and provide really outstanding care. And one, of course, is trauma, and the other one is stroke care. Maybe just comment on both of those areas.
For Grady, for a long time, it has been about trauma, stroke, burn care, access to emergent services. And those programs absolutely put a spotlight, get a spotlight, and serve the city and the community in a way that other hospitals aren't strategically positioned to do. As someone who is adjacent to both as a vascular surgeon, I have a lot of involvement with trauma and a lot of involvement with stroke care. It's fascinating to see the reasons that a patient may enter the healthcare system, whether it's something of their choice or is it a decision born out of necessity, i.e. the ambulance happens to take you there because that's where the care happens. And how those different pathways intersect at a place like Grady is fascinating, which obviously continues to also focus on, okay, how do we make it a destination choice for patients, not just a place where you go if you happen to be in a car crash. And that's a really interesting journey that I've seen firsthand.
If I looked across the spectrum of different specialists and generalists at Grady, surgeons, medical specialists, and so forth, how many of them actually had trained there?
Yeah. Starting in the big picture, if you look at everyone in Georgia, then this number sort of bounces around, but the one that gets thrown out there is that about 1 in 3, maybe even 1 in 2 physicians who practice in the state of Georgia at some point had some level of their training at Grady.
Oh, really?
So I think that sets the tone.
Wow.
I think we've done a good job of making sure that people who train there, we get to reap that investment that we've put into their education, that they stay on as faculty members. At the same time, of course, we don't want to become too insular. We're always looking to recruit folks from other excellent institutions, and I think have been successful in doing so. But you're right, it starts with that core group of folks who, because they train there, have that special connection that causes them to stay and to give back. I'm an example of that. You know, it was part of my training, but it was a very formative part. And it was when
This is when you came here as a fellow.
As a fellow, and I had done residency, and I think still had a lot of questions about what type of career I wanted. And Grady really helped shape that for me. And so I trained there and started a program there and have stayed there ever since.
Yeah, that's fantastic. I wanted to thank you, of course, for your role at Grady, for the fact that you're a leader in vascular surgery. You are the baton holder of a very special relationship with Emory Healthcare and Woodruff Health Sciences, and I couldn't be more thankful about your presence on our faculty, and look forward to working with you in years to come.
Thank you very much for the opportunity to speak with you today. Thank you for the opportunity to help lead in this role. Emory and Grady have been joined at the hip for over 100 years, and it's really fun to think about what the next 100 looks like.
Great, thank you.
Thank you.